Welcome to the College Essay Advisors podcast. Before we introduce ourselves, here's a little preview of what's to come.
It is nice to take a little time for self-care and not jump into the secondary planning immediately, but also knowing that they start to come out in late June, you don't want to just start thinking about it on June 21st, right? So our recommendation is to think about the categories and essay questions that have appeared in the past and start to draft that pre-writing so that you have pockets of writing to pull from that are already conceptualized, written, and polished, because it'll actually make you feel so much better about the whole process.
Welcome to the College Essay Advisors podcast, an ongoing exploration of how to write admissions essays that get you noticed and accepted. Hi, my name is Stacey Brooke, and I'm the founder and chief advisor at College Essay Advisors.
Hi, my name is Becca Myers, and I am Director of Advising at College Essay Advisors.
And today we're going to talk to you about the medical school essay application process, specifically the secondary essays for med school.
And we do have another podcast about the personal comments essay. So if you would like more information about this process of applying, that is also a place to look.
Most definitely. And that is sort of our more general essay that med school asks you for, asking about your motivations for applying and sort of the core components of why you want to do this. Then there are additional secondary essays, and maybe Becca, you can just break down for us what the process of receiving requests for secondary essays looks like for people who are unfamiliar.
Sure. So when schools send you secondary essays, it is an indication that they are interested. If you do not receive them, it means that particular school does not want additional info. They are not interested. And I always think about this med school application process as hazing. It is a trial by fire. And I think it's almost meant to test the ability of applicants to go through med school and put in the time and the effort to become a physician. Because what happens is when you receive these additional secondary questions from a school, you have a 2-week window in which to answer them. And some schools will send one question, highly unusual actually to get just one. Some schools will send up to 9. I had Duke University last year send almost that many. So you don't know what you're going to get. Most med school applicants are looking at, I would say, a minimum of trying to apply to 25. A lot of students are applying to up to 60 because
25 schools, not 25
25
essays.
schools, sorry, 25
Hmm.
schools, not essays. Because if a school's interested, you want to cast that net wide. We all know how competitive this is. So it's really hard
Hmm.
to turn down any school of interest, right? I mean, maybe it's not in the top 10 med schools, but becoming a doctor, if that's your dream, you're gonna try everything you can, right? So it would not make sense to not try to answer those secondaries. So if you think about as they start to roll in, usually in late June, a lot of them are coming in early July. Every school that you get from that initial receipt date, you have 2 weeks to answer the questions.
Okay, so Becca, what you're saying is that when a school sends you their set of secondary questions, when those come to you, that's the point at which the 2-week time clock starts. So if Duke sends you their secondaries, when they hit your inbox, the time clock for 2 weeks starts for Duke at that moment where another school could send them to you 3 days later, and then their 2-week time clock starts then, correct?
Correct. And so it involves meticulous planning and organizational skills, even just to keep track of who you owe what, right? Because if you're
Mm-hmm.
not keeping track of the clock and every receipt date and the window, it starts to
Mm-hmm.
snowball. Usually, students will begin the process feeling ready and enlivened. And then by the end of the first week, when you get 5 schools in one day, it starts to feel intimidating. So, organization is really, really important. Also, I want to point out that many students that are applying to med school are actually doing internships or shadowing over the summer. They're beginning the gap year process. And so while you are working a job, you are also staying up at night trying to do these applications. Rarely do I have a student who isn't sort of trying to get the requisite experience, right, in between
Mm-hmm.
the
Mm-hmm.
end of undergrad and applying. So it's a lot to think about. So one of the strategies that we recommend is looking at potential questions in advance and trying to draft before the clock starts for the secondaries that are coming in, because there are certain questions that repeat every year. And if
Or
you can
categories of
draft
questions that are common.
categories of questions,
Hmm.
yes,
Hmm.
there are categories of questions every year that repeat. And so if you can draft writing ahead of time that can be responses to variations of questions, then it's
Hmm.
helpful when you start to get the secondary applications to prevent panic and also to realize that you
Hmm.
have some already drafted, edited writing to pull from. It doesn't mean you don't continue to polish and make things school specific and adjust based on the individual secondary application, but it does mean that you don't have to dream up essays and topics
Hmm.
from scratch.
So in terms of timing, before May 1st, you're already thinking about your personal comments essay. So maybe like March, April, just wrapping your head around that particular process so that hopefully you can shoot out your personal comments essay. And then maybe June, while you're waiting to see who's going to request secondaries, you can approach these categories of topics and just basically draft or at least wrap your head around what are the core topics I want to address through these common categories so that you're ready to take those initial drafts or notes or whatever it may be and spin them into the requisite essays.
So we definitely recommend that students wrap their head around the personal comments essay first, because a strong personal comments essay is what's going to get you invited to submit secondaries. And the portal opens on May 1st. That's not when you should start thinking about this. You know what the essay requires. You should really start thinking about it in March and April, because it involves drafting and reconfiguring and polishing, and it's quite an intense process. If that doesn't stand on its own, then you're not going to get invited to submit secondaries. The trickiness of all this is that most applicants are wrapping up undergraduate education, and so they're busy with finals and doing other things, but it has to almost be considered another class and a priority, right? Which honestly,
Hmm.
people applying to med school are pretty good about that, because if you're even thinking
Sure.
about med school, you're probably organized and know what you're doing. So when you submit your personal comments essay, again, we're saying get in it as soon as possible. It is nice to take a little time for self-care and not jump into secondary planning immediately, but also knowing that they start to come out in late June, you don't want to just start thinking about it on June 21st, right? So our recommendation is to think about the categories and essay questions that have appeared in the past and start to draft that pre-writing so that you have pockets of writing to pull from that are already conceptualized, written, and polished, because it'll actually make you feel so much better about the whole process. So maybe Stacey, you can talk about a couple of those categories that we have seen over many years. This is not just like,
Yeah.
oh, we saw a trend last year. These are tried and true categories that
Hmm.
we say if you write this, you're going to use it somehow.
Yeah, very likely. So I'm just going to rattle these off fairly quickly. I think most of them are pretty self-explanatory. The diversity essay. How have you encountered diversity in your life? How has your own diversity impacted your view of the world? How will diversity in the medical field inspire you, impact the way that you practice? Adversity essay. What issues, challenges, hurdles have you faced slash overcome? The hobby essay. What else do you do? What do you like beyond medicine, and how might that interact with your future career? The gap
And
year essay.
I'll interrupt and say, sorry, for
Hmm.
hobby essay, can I just say that I
Hmm.
think one of the
Sure.
things they're looking for is how you practice self-care and how you decompress. So people that
Hmm.
have hobbies like anything from running to photography, it's really nice to highlight there because it shows that you are able to manage
Have
the
balance.
have balance. Yes,
Hmm.
yes.
Hmm. Love it. The gap year essay, if you've taken a gap year, why did you do that? What did you do during that year? The leadership essay, how are you a leader? How will you contribute to our community with those leadership skills? And the medical career for schools who want to know more intensively why our program, what specifically are you looking to do? Um, in terms of your studies and in terms of your future career that you might not have had space to cover in the personal comments essay. So those are, I think, the core areas in which these secondaries will likely probe for additional exploration. So if you have drafts of those essays, if you have even just robust outlines to pull from, if you know what you will address with each of those categories, it's going to make it infinitely easier when these secondaries start rolling in, avalanching in, for you to remain organized and rattle these off and ship them out as quickly as possible.
Yeah. And then when you get variations on questions and you think, oh my gosh, I don't have anything for that. Let's say a school asks, recount a time you failed and what you learned from it. You might actually go back and look at your leadership essay or your diversity essay, and there may be something there. I mean, it's
Mm-hmm,
interesting
mm-hmm.
sometimes as a leader, have you had a moment of failure before your leadership became stronger? You may not see a path of entry to that, but I firmly believe like my motto is anything can be recycled, right? Like you
Mm-hmm,
just have to
mm-hmm.
find the really beautiful hook and point of entry. And it doesn't mean that all 400 words can be recycled, but let's say you can take 200
Right.
of those words. Wouldn't you rather do that than have to write an entirely new essay within 2 weeks
Also,
about
if
failure,
you've
right?
isolated something as a topic worth covering for any of these schools, it likely will be a topic that you want to touch upon for pretty much all of them. If you're writing about it in any application, it means it's some core component of your personality, of your goals, of your mindset, that you want to relay. So I think, yes, recycling does not have to happen in the most direct straight line pattern. Often, I think, kind of twisting essays to meet the requirements of unexpected prompts. One gives you kind of an unexpected and fresh answer, and two allows you to kind of secret in that information that you're looking to tell admissions anyway, um, into the prompts that they're giving you.
Yeah, for sure. And I'm also going to recommend for students that are doing this pre-writing into categories to keep going rather than cut yourself off because some schools may ask for a 400 word essay on diversity and another school might ask for 200, but it's so much easier to cut down what you already have that's already polished. So don't assume that every school is going to ask that like sort of sweet 150 200 word short response. I would assume it's going to be much bigger and then cut down.
I want to address one last thing related to timing for these secondaries, which is that, as we were explaining earlier, the clock starts when the secondary hits your inbox. That's when your 2 week time clock starts. Inevitably, your dream school will fall in the middle of that just for the purpose of causing chaos, or you have no control over when these schools are going to release their secondaries to you. So I think there's also a delicate balance of one, being as early as possible with your submissions. I think, yes, you have a 2 week period, but pretty much anyone we've ever spoken to in admissions about these essays says that the sooner you can get them in, the better. You really don't want to wait until the last minute of that 2 week period to submit. I think demonstrated interest is nodded to by this timeliness and you're getting on it. So for schools, you're really going to want to try to ship them out as soon as possible. But if your dream school comes in and you have 10 other applications on your plate, you might want to kick that to the front of the line because it really does show that you are more interested. And this is part of the reason the schools weight your submission timing the way they do is they want to know they're your first choice. So if you're submitting day 2, day 3, day 5 of the 2 week period, it actually does show a school that it's your top choice. So these are all things that it's, as Becca has said many times, it's a delicate balance. There are lots of balls in the air always. It's a juggling process. And you're going to do the best you can. This is a very intense application process period. And I also think, Becca always says self-care. I think being kind to yourself during this process is also really important. And there is no perfect way to execute. These are just some tips that we're giving you to try to make the most of your opportunities and things to keep in mind. But ultimately, at the end of the day, all we're asking is that, you or all they're asking from you is that you're as prepared as possible, that you do the best you can, and hopefully some of these tips will help you, set the stage so that you can be really efficient and effective with this.
What is that saying? Is it perfection is the enemy of progress? Do you know this?
There are so
Perfection.
many of these. Perfect is the enemy of good. Perfect is the enemy of done.
Oh, that's
Um,
it. Perfect is the enemy of done. So I
yeah.
think about that a lot with this process, in that at a certain point, it is better to get it in a timely fashion than to obsess
Hmm.
over every single word. It should be thoughtful and it should be well crafted and edited, but there's also a certain understanding with these schools that that window is small. And so
Hmm.
if you're struggling and you wait 3 days to come up with the perfect adjective to describe your stethoscope, let's move on. Submit that, right? Get it in, because it matters so much more than like the lyric beauty of how you're describing your job, right?
Yeah,
Like,
it's
yeah.
certainly a balance, and I do think this is, as again, Becca, you've said earlier in this episode, this is practice for the hectic nature of med school, and potentially treating people in the future. There are this is a multitasking oriented profession, and the education that comes along with it is also pretty fast paced and requires the ability to juggle a lot of things. So I think you're gonna get practice here, but you can do it. Um, and we're here to help. We have more resources on our website to help push you through the process. We're also obviously always here at CEA for personal help if you need it. But we believe in you, and we know you can get it done.
That's our episode for today. Thank you so much for listening or watching. If you like our content, please like and subscribe to follow us for more. Happy writing!